In this week's Women's Care Wednesday segment, Michelle Barton with Women's Care Florida is here to explain the benefits of infusion therapy and how their 3 infusion centers may be able to help you. Good morning. Good to see you again.
Nice to see you.
So let's talk about this. To be honest, I don't know a lot about infusion centers. I'm learning more by talking with your team and how special this, but why would people need infusion centers or infusions? Let's start there.
This keeps patients out of the hospital and has them in a more convenient, comfortable location where they can manage their disease and keep their symptoms under control.
So what are people getting infused with? I mean, what is the typical patient that would need an infusion center?
Well, I have gynecology oncologists that we give chemotherapy to those patients. So we have 3 infusion centers, one in Orlando, one in Tampa, and one in St. Petersburg. But with Women's Care adding multiple specialists, I can also give hydration to my OB patients. We have patients that are iron deficient. We give that have anemia. We give them medications as well. If you have a Crohn's disease or ulcerative colitis, we have a GI physician that can order medications. So we can give anything that could go into a vein, sub-Q, to help manage symptoms for patients.
Well, and talk about the benefit of actually having these centers kind of located with your team and with your office, because from what I understand, most infusion centers are at a hospital. Is that correct?
Correct. The majority of infusion centers are hospital-based, so this keeps patients out of the hospital, keeps them in a more home-like environment where they can come on their time schedule. It is what is convenient for them and their family to be able to continue their activities of daily living. We don't want patients to be restricted but still need to manage their symptoms. It's a comfortable environment. My nurses are all advanced cardiac life support. They all have their oncology nursing certification from the ONS. And they can provide that one-on-one care. It's individualized to where they can know the family, know what's going to make that patient. Each patient wants to tell their story, and while they're there, we can understand and identify with their needs.
Well, and speaking of patients, are there things that you know, patients should be asking their doctors or their team of doctors, or maybe if they're about to start this process? You know, we always say knowledge is power and know what you're getting into. I mean, what are some things that you think patients should know or look for?
It depends on the different disease process, but what the patient should go is when they speak with their physicians and they have had to receive routine medications, ask if this is something that we could do at the infusion center to keep them out of the hospital, to keep them safe. For our ovarian cancer patients, it's those symptoms of bloating that unfortunately get overlooked. They go to see the GYN doctor. They come to see my gynecologist oncologist, and we're able to treat them and help them have a better life.
Well, anything before we wrap up, anything else you think we should know about the infusion center or what your team is doing? Again, it's pretty unique that you have this, you know, kind of right in-house.
It is very unique, and just for women's care in general, the OB population would be to keep those patients out of the hospital so that they can come in, get hydration, and be able to take care of their daily living.
Well, thank you so much for your time this morning. We appreciate it. We're going to put all the info where people can get in connection with you, your team, find out more information. There is the website to do that as well. So thank you so much.
You're welcome.
We appreciate your time this morning.
Thank you.